Assalamualaikum and hello everyone. My name is Sharifah Alamai Sarah binti Said Muhammad Idrus and my matric number is 2022462196. As the population of the country grows and a sudden shift in public health occurs, it is important to have adequate healthcare service to ensure long-lasting human well-being. The Ministry of Health Malaysia is a responsible department that progressively advances the healthcare service and quality of life of the citizens and build a stable economy through the healthcare sector. However, for the past few years, chronic kidney disease has been a major public health concern in Malaysia, where the prevalence of chronic kidney disease (CKD) and end-stage kidney failure (ESKD) is increasing. CKD prevalence has risen from 9.1% in 2011 to 15.5% in 2018. If current trend continue, the number of ESKD patients is expected to reach 51,000 by 2020 and 106,000 by 2040. This load is expected to cost the healthcare system RM1.5 billion and RM3.2 billion respectively. However, number of nephrologists is declining to support the current number of the patients that keep increasing in Malaysia. To cope with that, Ministry of Health should enhance its number of nephrology while prioritizing investment in high quality care and primary care.
Hello, my name is Tekuna Syafiqah binti Tengku Effendi. I'm going to present about health workforce and trend. As we can see in the chart, LWP Kuala Lumpur is the higher number in private sector, which is only 21 of nephrologists. Sabah is the lowest number of nephrologists in private sector, which is only 1. For public sector, Selangor is the highest number of nephrologists, which is only 18. While the lowest number of nephrologists in public sector is only 1 in Kelantan and Pahang. After that, there are no nephrologists lab in LWP Putrajaya, LWP Labuan and also police in public and private hospitals. As for the density of nephrologists, I would like to take example of the most highest density nephrologists in Malaysia, which are Malaysia's capital. LWP Kuala Lumpur with density 1.62 per 100,000 population, followed by Pulau Pinang 0.92 per 100,000 population, and then Selangor is 0.61 per 100,000 population, and so on. Thus, what I can conclude that the number of nephrologists in Malaysia to cover the number of population is not enough, as it did not reach the actual ratio required. So, we can say that the number of nephrologists in Malaysia to cover the number of population is not enough. So, that's all from me. Thank you.
Nephrologists in Malaysia can workforce face several challenges. Some common issue is first, shortage of nephrologists. There is often a scarcity of nephrologists in Malaysia, leading to a high patient-to-doctor ratio. This shortage can strain the healthcare system and result in delayed or inadequate care for patients with kidney-related conditions. Second, increased workloads. Nephrologists often face heavy workloads due to the growing number of patients requiring kidney-related care. This can lead to longer working hours, increased stress, and potential burnout among healthcare professionals. Third is limited resources. Adequate resources such as dialysis machines, medications, and advanced diagnostic tools are essential for effective nephrology care. However, limited resources and funding constraints can hinder the delivery of resources and funding constraints can hinder the delivery of optimal care to patients with a kidney disease. Lastly, rural-urban disparity. Access to nephrology services may be disproportionately concentrated in urban areas, leaving rural populations with limited or no access to specialized care. This disparity can result in delayed diagnosis and treatment, negatively impacting patient outcomes.
Hi, my name is Putri Fatinur Ain, and I will be presenting about the recommendation for the Malaysian healthcare regarding the issue related to the shortage of nephrologists in Malaysia. So one of the ways to overcome the number of CKD patients is to give awareness to the Malaysian citizens about the risk factors of getting kidney problems. Awareness such as education, early health screening or medical checkup, program for healthy lifestyle and healthy eating habits and policy improvement related to foods and smoking can reduce the trend numbers of CKD patients and prevent people from getting kidney disease. The reduction number of CKD or kidney disease can lower the burden faced by nephrologists, and this will give the sufficient number of nephrologists in Malaysia. Next, in response to the issue related to the shortage of nephrologists in remote areas, it is recommended to use telemedicine, which enables nephrologists for long-distance monitoring by doing appointments and exchange of medical information via video or phone between patients. Telenephrology is one of the telemedicine technologies that being used by nephrologists nowadays in worldwide. Expansion of telenephrology services in rural areas is necessary nowadays since it can also lower the cost, minimize transfer of patients, reduce mortality in remote areas, effective supervision from nephrologists, and not necessarily having a long stay in hospital. Furthermore, requiring patients with kidney disease, especially dialysis patients, to do a daily diary of their healthcare condition is one of the recommendations that can be used. Supervising patients with their diary can reduce the burden and exhaustion to nephrologists as they can extend long appointment if unnecessary, and they can focus more on chronic patients. Other than that, allocation of nephrologists to areas with a high number of patients with kidney diseases also can improve the delivery services in the nephrology sector. Getting an accurate number of patients of each state in Malaysia enables a good management to allocate nephrologists as the needed areas can be focused on, and rural area especially can be supervised more effectively. In other ways, allocation of nephrologists in the center areas of each state or districts in Malaysia and locate several nephrologists based on the wide areas of each state or districts will give patients in all over Malaysia to easily seek specialists as it is near to their places. The purpose of this allocation is to give a short route and easy access to patients and guidance to continue referring to nephrologists. This can give a broad area of nephrologists in monitoring patients with kidney disease and together avoid lack of supervision to the patients in rural areas.
My name is Roliza. My part is to present conclusion on this topic. In the conclusion, the number of nephrologists is always increasing, even though the number is not very significant. Malaysia still doesn't have enough experts in this field to treat a number of Malaysians who are constantly increasing kidney disease every year. Nephrologists are very important in diagnosis, treating kidney conditions and kidney failure. The prevalence of CKD-related death in Malaysia may change due to the lack of supervision due to the shortage of nephrologists in rural areas. The Malaysian Ministry of Health should also think about insufficient specialists in this field, which can cause them to experience fatigue and stress with the ever-increasing number of patients to treat patients suffering from kidney disease. Malaysia's shortcoming in this field can be overcome when all parties like government, education programs and medical university must work together to overcome this issue. Malaysia has to rapidly boost in nephrologist population while giving primary care and high quality care funding to priority in order to fulfill the demands of the country's expanding patient population. In order to secure long-term human well-being when the population of the country increase and the public health suddenly change, it is critical to have enough healthcare service.